When you think about pregnancy, a picture of a baby bump probably comes to mind. But did you know that the most delicate and crucial period of pregnancy isn't when your baby bump starts to show, but rather the first 13 weeks, which often go unnoticed by anyone? This is the time when the foundation for all your baby's organs is being laid, their heart, brain, and spinal cord. The precautions taken during this period are what guarantee a healthy future. This video is for informational and educational purposes only and should not be considered a substitute for professional medical advice. Always consult your doctor for any of your health concerns. So, for the next few minutes, forget everything else and focus on this guide. This is your trusted medical roadmap for the first 13 weeks of pregnancy, which will tell you how to understand early symptoms, what tests to get done, and which habits to adopt and which to avoid for your baby's health. Section 1. Early symptoms. What is your body signaling? As soon as your pregnancy is confirmed, your body starts going through many changes. These symptoms are completely normal and are the result of hormonal changes happening in the body. One of the most common symptoms is morning sickness, which means nausea and vomiting that can occur at any time of the day, not just in the morning. Additionally, due to the increase in the progesterone hormone, you might feel extreme fatigue, a kind of tiredness that doesn't go away even after 8 hours of sleep. You might feel the need for frequent urination. This happens because of the HCG hormone and the increased blood flow in the body, which forces your kidneys to work harder. Breast tenderness or pain and sudden mood swings, like feeling very happy one moment and irritable the next, are also very common. All these are signs that your body is preparing itself to nurture a new life. Section 2. The most important medical tests. What, why, and when. As soon as you suspect you're pregnant, the first step is to see a doctor. Getting some tests done in the first trimester is extremely important to ensure that both you and your baby are healthy. Confirmation of pregnancy. After a home urine test, a doctor confirms it with an ultrasound and sometimes a blood test. In most cases, a urine test at the clinic and an initial ultrasound are sufficient to confirm the pregnancy. In some specific cases, like if a complication is suspected, the doctor may also advise an HCG blood test. Essential blood tests. This includes checking your blood group, hemoglobin, to check for anemia, and Rh factor. Along with this, the doctor also screens for infections like thyroid issues, hepatitis B, and HIV to protect the baby from any health risks. First ultrasound, dating scan. This usually happens between 6 to 9 weeks. It confirms the baby's heartbeat, determines the estimated delivery date, and checks if the pregnancy is in the correct location within the uterus. NT scan and double marker test. Between 11 to 13 weeks, the doctor may recommend an NT scan, nuchal translucency, and a double marker blood test. This is a very important screening that helps detect the risk of any chromosomal abnormalities in the baby, such as Down syndrome. These tests create a strong foundation for monitoring your and your baby's health. Section 3. Diet and lifestyle. What to do and what to absolutely avoid in the first trimester. Your diet and lifestyle directly impact your baby's development. What to eat. Be sure to include folic acid-rich foods in your diet, like spinach, lentils, and beans. According to the Centers for Disease Control and Prevention, CDC, folic acid is one of the most essential nutrients for the development of the baby's brain and spinal cord. Besides this, consume a diet rich in protein, cheese, eggs, lentils, calcium, milk, yogurt, and iron. What not to eat. You should completely avoid certain things during this time. According to the U.S. Food and Drug Administration, FDA, avoid eating raw or undercooked meat, raw eggs, and unpasteurized milk or cheese made from it, as they can contain harmful bacteria like Listeria. Yes, well-boiled, pasteurized, milk, yogurt, and cheese are completely safe and beneficial for you. When it comes to fruits, it's better to stay away from raw papaya, as it contains latex and papain which, in large quantities, can cause uterine contractions. However, well-ripened papaya is considered safe in limited amounts. Similarly, there are concerns about pineapple, but there is no solid scientific evidence of harm from consuming it in normal quantities. Reduce caffeine-containing items like tea, coffee, and chocolate. According to the American College of Obstetricians and Gynecologists, ACOG, you should not consume more than 200 milligrams of caffeine per day, which is equivalent to about 1 to 2 small cups of coffee. High caffeine intake can increase the risk of miscarriage. Stay completely away from alcohol and smoking, as they can cause serious damage to the baby's brain development. If you are also going through the experiences of the first trimester, tell us in the comments below how you are taking care of yourself. And don't forget to subscribe to the channel for our next video on the second trimester of pregnancy. Section 4. Warning signs. When to contact a doctor immediately? Although most symptoms are normal, there are some warning signs that should not be ignored at all. If you experience any of the following, contact your doctor without delay. Spotting or heavy bleeding. This can be a serious sign. Severe abdominal pain or cramping. Excessive vomiting, preventing you from digesting anything. High fever or a burning sensation while urinating. Always remember, prevention is better than cure. Do not hesitate to talk to your doctor about any concern, big or small. The first trimester of pregnancy is certainly full of ups and downs, but this is the time when you are laying the foundation for your child's healthy life. By adopting proper nutrition, timely medical checkups, and some necessary precautions, you can take a big step towards a healthy and safe pregnancy. Trust your body, rest, and live every moment of this beautiful journey.